Hi guys, today we have come here with a new topic, and the topic for today is folic acid in pregnancy and pre-pregnancy care. Most of you would know this vitamin, folic acid. You would have been taking it for many reasons, like what I said, in the pre-pregnancy time or in the pregnancy time, and sometimes when you are anemic or having some other diseases. In pregnancy and pre-pregnancy time, it is very important that we take this crucial vitamin so that the baby doesn't have birth defects. Neural tube defects or defects with the development of skull, brain, spinal cord and the covering around the spinal cord are very well known to folic acid deficiencies. That is when the interest of folic acid supplementation to pregnant women started picking pace. And now we know not just neural tube defects, it can also lead on to cardiac defects in the child. I am Dr. Anu Joseph from Trinity Healthcare Clinic, your obstetrician and fetal medicine specialist, who would be discussing about the why, what and when of folic acid with you. So typically, talking about the obstetric and gynec reasons for starting folic acid, we would start folic acid at least a month before starting for trying for pregnancy. This ensures that you have a good amount of folic acid in your body, which would help the development of the growing embryo. It would prevent neural tube defects, it would prevent severe cardiac dysfunctions and cardiac anomalies in the baby, and also it has its role in preventing low birth weight babies. In some conditions like homocystinemia or hyperhomocystinemia, folic acid is also very essential in reducing the chances of miscarriages. So all in all, it is important and probably the only medicine or only prenatal vitamin that you would be given if you are otherwise healthy. When should you start this? Like I said, at least a month before. And when should you stop this? Ideally, not at all throughout your pregnancy. But we do stop it at 3 months of your pregnancy, because after that, we do start with something called as iron supplementation, and most of the iron tablets will have folic acid in them. So you don't need to have a double dose. So folic acid ideally should be started 1 month at least before you start planning your pregnancy and needs to be continued throughout your pregnancy. A common question that we hear is, it's also available in our food, then why should we take it? The answer to that is yes, green leafy vegetables, legumes and citrus fruit do give a good amount of folic acid for us. But when it is pregnancy and in the pre-pregnancy time, our requirement for folic acid increases. Parallelly, once you're pregnant, you do have some amount of nausea, vomiting, which makes our eating habits a little bit unpredictable. There are higher chances that you might have folic acid deficiency, especially the additional requirement your pregnancy puts you into. And hence, this can be a trouble in terms of miscarriages, birth defects in the child, or a low birth weight baby by the end of pregnancy. Prevention, as you all know, is way better than cure. And folic acid is a tiny little tablet which doesn't cause any side effects for you. So in that regard, it is very easy for all of us to be on folic acid supplementation in the pre-pregnancy and the pregnancy time. Hope this video was useful for you. Thank you.